and development lecture. Now, I know you're probably already rolling your eyes. You're not looking forward to this one. I know this isn't a really fun topic, but the fact of the matter is it does show up on your NCLEX. It is heavily tested, and a lot of us struggle with it. So let's break it down together, make it as fun and simple as possible, and get this done. So what we're going to do to make this as easy as we can is break everything down into stages. Obviously, these are generalizations. You're going to see some resources that say an infant is less than 12 months, whereas in Erikson's theory, they go all the way up to 18 months. So take everything with a little bit of a grain of salt. Know that you can see a little bit of variation even between reputable sources. We're going to be talking about two big theories to know within each of those stages. The first is Erikson, and this theory is going to deal with psychosocial development. The second is Piaget, which is going to look at cognitive development. You, of course, have Freud too, but I don't see that tested quite as heavily, so we're going to focus on the things I know are going to show up on your NCLEX. Okay, so let's start chronologically with our very first stage, our infants. So under Erikson's theory, this is going to last from birth all the way up until 18 months, and this is called the trust versus mistrust stage. So when we're looking at a stage of the Erikson theory, we're always trying to achieve something. For infants, that is trust. They're trying to go through life and achieve that trust. So this is going to be things like they cry when they're hungry and their parent feeds them. Their nourishment needs are met. They cry when they have a dirty diaper, when they're uncomfortable, and that parent responds. They gain trust through all of those responses. They need something, that need is met. Now, on the other hand, if the infant is with a caregiver that does not respond to their needs, they're hungry, they cry, and they're not fed. They're uncomfortable because they have a dirty diaper and their diaper isn't changed. That infant will not be able to progress to the next stage. They're going to be stuck in this stage of mistrust. Now, for our cognitive development, that's our Piaget theory, infants are going to be in the sensory motor stage. And this stage lasts all the way from birth until they are 2 years old. Piaget's theory of cognitive development tells us all about how we are learning. How are we collecting information from out in the world, processing it in our senses, and integrating it into our daily life? So sensory motor, the infants are learning through their senses and through their movement. They're putting things in their mouth, they're grasping things, looking around, listening. They're picking up on the world around them. This is the time where they learn cause and effect. I throw my rattle on the floor, it makes a loud noise. If any of you have kids, you know your baby might do that over and over because they're amazed at their action causing the effect of that noise, and they're learning about that. One fun thing to note during this stage is that object permanence is not developed until about 9 months old. So when we say object permanence, we mean that the infant is able to understand something continues to exist even when it's out of their line of sight. So this is why peekaboo is so fun with little babies. You go behind your hands, and to them, you're literally disappearing until about 9 months when they obtain that object permanence and they understand you're still there behind your hands. So let's talk about some specific growth and development considerations for when the infant is ill, since as a nurse, this is likely when you're going to be interacting with this population. Keep in mind the stage of development that they're in, that psychosocial development where they're trying to gain trust. Well, that means that during hospitalization, consistent caregivers is going to be our priority. We want that baby to get to know us, to recognize us, to know what to expect. We want to meet their needs promptly. Don't leave them crying in a dirty diaper for an hour. That's not going to help them achieve trust. Okay, the next few slides are a little dense. I apologize, but these are the things that are definitely the highest tested items, these growth and development milestones. When can the infant do what? All right, these are important for us to know for a few reasons. First and foremost, knowing what is appropriate to give to that child, do with that child. What type of toy would be appropriate depending on their developmental milestones. We also want to be aware of their developmental milestones as mandatory reporters of abuse. If an infant comes in with a broken femur and the mom says, oh, they were walking and tripped, I know that that's not consistent with what I would expect that child to be able to do. So my alarm bells are going to go off and I'm going to want to ask some more questions. So be aware of these milestones for those reasons. Now, I've tried to make some little memory tricks to make it a little bit easier. So starting off with 3 months, it's a 3-letter word, coo. The baby should be making cooing sounds, kind of gargling, looking at people, smiling. They'll have different cries for different needs. The parent will be able to tell you, oh, they're hungry, oh, they need changed. And that baby is going to recognize their parents' voices, all right? They're going to be able to express different sounds like pleasure versus when they're in discomfort. But it's all just sounds, cooing sounds, all right? As far as gross and fine motor, the baby's going to be doing tummy time and they should be able to hold their head up during tummy time. This is also when the posterior fontanelle should close. By about 2 months, that posterior fontanelle should close up. So you'll want to check for that in your head-to-toe assessment. Okay, now at 6 months, we're going to move on to a 6-letter word, babble. So 3 months, they were just cooing. 6 months, now they're babbling. They're repeating syllables, mama, dada, ba, gurgling sounds, giggling, and laughing. They're going to be able to use their voice more to express pleasure versus displeasure. You can actually go back and forth and take turns with them making sounds. So they're not saying full-on words yet, but they're babbling. All right, between 6 and 12 months is when we're going to expect to see them starting to crawl. Notice how that can vary a little bit, all right? Some kids start really early, some kids it takes a little bit later. But between 6 and 12 months, that's what we expect. Last thing to note here is about birth weight, all right? Babies are growing rapidly at this stage of life. They grow somewhere between ½ an inch to an inch every single month. Wow. And they're gaining 5 to 7 ounces per week. So around the 5-month checkup, that's when we want to make sure that their birth weight has doubled. That's an important growth milestone to make sure you remember. Moving right along to our 9-month checkup, our word here, it's going to be a 9-letter word, imitation. So first they cooed, then they babbled. Now they're gaining more and more language skills. They're going to be trying to imitate different sounds that they hear. So animal sounds are very fun at this stage. They should be stringing some syllables together, mama, dad. They might be saying one word here and there. This is also when they can sit up without support, so that motor skill and that core strength, they're no longer just doing tummy time and lifting their head. Now they're sitting and actually able to support their trunk without mom or dad sitting right there. Next, at 12 months, you can remember they say 1 to 2 words. So your 12-letter phrase to help kind of remember what's going on at this stage is understand me. They want you to understand them. They're starting to communicate with you, actually using words. 12 months is the first time when we're getting full-on words. They might have small little requests, phrases, yes, no. No seems to be the favorite. I know we see a lot of kids say no, no, no at this phase. And they're also going to recognize familiar words. You say ball, they should be able to look at the ball, go grab it. Dog, if they have a dog in the house, they should recognize that word dog. Now, at 12 months, they should be standing, all right? So 9 months sitting, 12 months, they should be standing. Some kids are already starting to take their first steps by this point, okay? But we wouldn't consider them, behind on their development if they weren't. They should, however, be able to stand. Now, growth is slowing down a little bit, but they're still getting much bigger very quickly. They're growing somewhere around 3/8 of an inch every month and now gaining more like 3 to 5 ounces every week. So by 12 months, that 1 year checkup, we should see that their birth weight has tripled. All right, last infant milestone here. We'll have a check-in at about 1.5 years, 18 months. And this is when we want to see them walking, all right? So 12 months, we should be standing. 18 months, they should be able to walk by now. This is also when we should be able to assess that anterior fontanelle and see that it has closed. So posterior, we're looking to close at about 2 months. Anterior takes a lot longer. Anterior fontanelle should close at 18 months. It might close earlier. That's okay too, but by 18 months is when we should see that for sure. Now, language milestones. At 12 months, they were starting to say words. At 18 months, they should now have a vocabulary of 18 or more words. So language acquisition is rapid in this phase of life. They're going to be repeating words that they overhear their mom or dad saying. They might recognize familiar objects, point to them in books. Again, animals and sounds tend to be really fun. Moo, they point to the cow. When you ask them a simple question, they should be able to understand it. Do you want to eat dinner? Yes or no. They should also be able to follow a simple command. Go get your shoes. They should be able to go get their shoes and point to parts of their body. So they're understanding a whole lot more than 18 words, but they should be able to communicate with a vocabulary of at least 18 words. Now, there's one other thing that I want you assessing along with this child's growth and development. That is their reflexes. So kids having a reflex or not having a specific reflex really helps us assess their nervous system. Remember, they're growing very rapidly. That means all the systems of their body are growing and developing. And there are specific reflexes that should and should not be present that can tell us about that child's nervous system. So we have 4 main reflexes to assess as part of this growth and development. We have the Moro, Babinski, Palmer, and Rooting. So Moro, you've probably heard before as the startle reflex. We're going to elicit this by we're going to put the baby on our lap, kind of sit them up, lay them back a little bit, and then kind of let their head and neck fall back. You still want to have your hand there to support it. Remember, they can't support it by themselves, but you're going to let them kind of feel like they're falling. Gently, don't drop the baby. That's going to startle them, however. You can also use a loud noise, okay? You can kind of clap right in their face, make them jump. All right, that jump, that startle should look like this. Arms going to extend and abduct. So they're going to go out and then they're going to flex and adduct, bring it back in. All right, that's what we should see happen from birth to about 6 months of age. That's normal. If we keep seeing that Moro reflex or that startle reflex after 6 months of age, that tells us there's some possible neurologic abnormality. Next is Babinski's sign or the plantar reflex. We elicit this by taking some kind of hard, pointy-ish object like pen cap. I've used my pen light before. And we're going to stroke the bottom lateral aspect of the foot. So the side that's on the pinky toe side. Stroke up towards the pinky toe, over to the big toe, kind of in a J shape. A positive Babinski is the toes hyper-expending. So they're going to fan out, splay outwards. Negative Babinski, nothing happens. So we're going to expect positive Babinski to be present as a newborn up until about 1 year of age. Under 1, Babinski is normal. We want to see it. If it's absent, some sort of abnormality might be there. In an adult, we might test that Babinski to see if something's going on in their central nervous system. Positive Babinski in an adult tells me there's a neurologic problem. Same though for an infant with a negative Babinski, all right? Because I want to see that in a newborn. If a newborn doesn't have that positive Babinski, there could be something going on, all right? So under 1, we want to see it. Over 1, we do not want to see it. Next, this is my favorite one, the palmar grasp. So we looked at their foot with the plantar reflex. Now we're going to look at their hand. All you've got to do, place something in their palm, usually your finger, and what we should see is that their hand wraps around it. It's so cute. Oh, they're holding my hand, they're holding my finger. This is another one. We should see it as a newborn, and then it should start to diminish between 3 to 4 months of age. Lastly, pretty simple, you're all familiar with the rooting reflex. And this is what helps infants survive and latch onto a nipple to breast or bottle feed. When you stroke the side of their cheek, they're gonna turn their mouth and try to latch onto that. That's a positive rooting reflex. We should see that at birth, and it starts to diminish between 3 and 4 months of age. We could still see it up to a year. It's not abnormal until after 1 year of age. Next thing I want to touch on for the infant stage is education. Obviously, a lot of your education is geared toward the parents, right? The parents are the one caring for this infant in hopefully a developmentally appropriate way. Infants are still completely nonverbal. But don't forget that they're in that Erikson phase of trust versus mistrust. They're picking up on your cues. Remember Piaget's stage of cognitive development, sensory motor. They're taking all of this information in with their senses and their movement. So nonverbal cues like touch, that's going to enhance that cognitive development. Responding to their cues, that's going to help them achieve that task of trust. Now, 2 big things to educate those parents on: car seats and sleep. These are big heavy hitters in that safety and infection control of your NCLEX, and it could also be categorized as health promotion and maintenance, okay? So car seats, we want them in a rear-facing car seat until they are at least 2. If they can stay in it longer, that's great. We want a 5-point harness. That clip needs to be at the level of their armpits, all right? That's where their ribs are, so we want it covering those ribs so that if the car comes to a sudden stop, it's going to put pressure there and stop them from going forward. If that clip is down like over their belly, that's where their organs are, and a sudden stop is actually going to cause organ damage, okay? So clip right at their armpit. And we don't want like big puffy coats or jackets on under that car seat. That's gonna make it so that we have a bunch of space, a big gap between the car seat buckle and them, and that is not safe. So no big puffy coats. We can put that coat over them if it's cold outside, but there needs to be nothing between that car seat buckle and them, okay? Now, safe sleep is the other big one. If you have kids, you were probably gone over this in the hospital before you were discharged home with your newborn. We want them on their back, in the crib, alone. Those are the basic tenets of safe sleep. Firm mattress, tight-fitted sheet. We don't want a loose sheet, a blanket, a stuffed animal, anything like that, okay? Because it could end up suffocating that infant and they're not going to be able to get it off of their face, out of their airway. They're not strong enough to do that yet. So on their back, alone in the crib. Pacifier's okay. Everything else, we want to keep it out of the crib. We already went over those weight milestones, but they're super important. So remember, double by 5 months, triple by 1 year. Last thing I'll throw up here for infants is the immunization schedule. Now, you've got a cheat sheet with all of this, so I'm not going to make you listen to me read all of this out. Here's the reference from the CDC so that you can always go get that most up-to-date information. One especially important point is that influenza vaccine is safe starting at 6 months of age. So 6 months old or greater, they're going to get that flu shot yearly. Okay, next we have our toddlers. So when we dive into Erikson's stage of psychosocial development, that's going to be about 18 months to 3 years. For Piaget's cognitive development, we see toddlers entering a new stage that he calls the pre-operational stage at the age of 2. So let's talk about Erikson first. Remember, when we're talking about Erikson, we're talking about trying to achieve a specific task, to kind of pass some sort of milestone in that stage of the child's development. For toddlers, it is autonomy versus shame and doubt. So they're trying to achieve autonomy. If they cannot successfully do that, they get stuck in this shame and doubt. So the classic example here is potty training. 18 months to 3 years, this is typically the range where we're seeing kids learn how to use the toilet by themselves. And in doing so, they're achieving this sense of independence. They're able to do something for themselves. Maybe it's choosing their own clothes, doing their own zipper, selecting between 2 different food choices. Whatever it is, they're really feeling that sense of independence. Now, let's say they're not able to achieve that, if they're having a lot of trouble with those simple tasks for one reason or another. Or maybe their parent doesn't allow them to have any choice and they get stuck in feeling really shameful. They're punished because they're not able to zip up their zipper appropriately. They start to really doubt themselves. They're not able to make that independent choice. That failure leads to them getting stuck in shame and self-doubt. Now, cognitively, the toddler moves into Piaget's pre-operational stage at the age of 2. Now, remember, prior, they were in that sensory motor stage. They were using their senses and their motor to kind of learn about the world around them. Well, now they've built up a certain level of cognition, and they're in this pre-operational stage where I think about it like they're not quite operational yet, but they're getting there. So they can think symbolically. They're not really using logic. Any of you who have toddlers know it's very hard to reason with a toddler. This is why they don't have that logic yet, but they're able to symbolically think about the world. Symbols and gestures can represent an event. The child's typically focusing on just one thing. They have tunnel vision. They're not going to be able to look at the big picture, bird's eye view of a situation, and they are going to be at the center of everything. They absolutely have a very egocentric worldview, and they're not going to be able to see the world from other people's perspectives. They're at the center. Everything revolves around them, all right? Now, to help them develop at this stage, we want to be really hands-on with them, all right? So use visual aids, toys, actions along with words, things where they are really getting involved. And that's especially important during illness. If you are an inpatient nurse and you're dealing with a hospitalized toddler, we want to know what stage of that development they're in to really help them cope most effectively. So help them develop that autonomy. Give them choices where possible. Get hands-on. Use visual aids, dolls, and toys. We might want to allow them to have their favorite toy from home if it's appropriate to give them some security. There are 2 big types of play that the toddler will engage in: parallel and symbolic play. So remember we talked about in that cognitive stage, that pre-operational, they're starting to be able to use objects to symbolize things out in the world. So when they play pretend, they're using different objects in that idea of play, that symbolic play. They also tend to do that parallel play where they'll play adjacent to other children, but they're not so much interacting with each other yet. Because remember, in that pre-operational stage, they still have a very egocentric worldview. They're not thinking about how their action impacts somebody else. They're really only thinking about how the world relates to them. Now, our milestones here to help you remember: at 2 years old, they're going to be speaking in 2-word phrases and following 2-step directions. So before, we were using a vocabulary of about 18 words. Now they're actually stringing some of those words together. And when we give them a direction, they're able to follow 2 steps. So before, they could pick up the ball. Now you should be able to say, pick up the ball and give it to me. Their vocab has expanded dramatically. Now we're using 50 or more words. And when they talk, most of the time, the caregiver should be able to understand them. Remember, they're going to be using symbolic play, so gestures and words for pretend play. Gross motor wise, they should also be able to run and kick a ball by the time they reach 2 years old. So, how about education for the toddler? First and foremost, they're at the age where you want to involve them. They're in that pre-operational phase of thinking and learning. They want to be hands-on, touching, and understanding. So it's a great idea to use toy medical equipment and dolls, allow them to touch, get hands-on with what's about to happen. We also want to be talking in simple, concrete terms. Remember, they're not going to have a high ability to logic and reason. They're still in that pre-operational phase. So keep it simple. Don't make things too complex and get them involved in hands-on education. Now, safety-wise, how do we want to educate parents about keeping their toddler safe? This is a high-risk age for injury. First, they're eating solid foods now, and we want to avoid things that are choking hazards. So classic examples here, popcorn, grapes, and hot dogs. Those are things that can become lodged in the esophagus and cause the child to choke. So let's avoid those specific foods. It's also a really high-risk age for accidental injuries. Burns, they might pull things down off of the stove. We're really going to have to make sure that we toddler-proof the house so that they're not at risk for these injuries. They're very curious, reaching, grabbing, touching things, and they might not know it could hurt them. So we want water, 120 degrees Fahrenheit or below. Hotter than that can burn them. To avoid them from pulling boiling water off the stove or anything hot off the stove, make sure to use those back burners. Turn the handles around so they're not facing out where the child could grab them and pull them off the stove. Age 2 is when they can go into that forward-facing car seat. But remember your other car seat education we talked about for the infant. We want that clip to be at the breastbone, kind of armpit level, not down below. And we don't want them wearing big puffy coats under their seatbelt. That still applies. Lastly, we still have immunizations, of course, all the way through life. They do start to taper off though. We had a whole long slide of immunizations that we talked about for our infant. Into those toddler, preschool, school age years, they start to get less frequent. So make sure you're following that chart and educating about the necessity of vaccination. At this age, remember, after 6 months, we're getting that influenza shot every single year. Moving right along, next up we have our preschoolers. This is a really fun age group, and for Piaget, you don't actually have a new stage to learn. Remember, they're still going to be in that pre-operational, very egocentric, very concrete thinkers, all the way up until they're 7. That goes from 2 to 7. For Erikson, in our psychosocial development, we do have a new stage. Preschoolers are 3 to 5-ish, and that is the stage of initiative versus guilt. The task that preschoolers are trying to accomplish in this stage of psychosocial development is the ability to exert some control over their environment, to take initiative. So when they plan and accomplish a task, being successful in that gives them that sense of purpose, that initiative. So we can help them accomplish this task of development by modeling good behavior, allowing them to make choices where appropriate. You do have to set those safe boundaries, right? We might not want to go head first off the diving board in the shallow end, but when they are successful in a task, we want to praise them, let them know they've achieved something worthwhile, and give them that sense of accomplishment. Because if they don't feel that achievement of initiative and that sense of power a little bit, then they could get stuck in that guilt phase where they're not able to achieve initiative. So what that looks like is when children feel judgment, criticism, they are constantly dependent on others because when they try to do something, they don't see that initiative. They don't see that result. When they fail to achieve initiative, they lack confidence and end up feeling really guilty, and they can get stuck in this phase of psychosocial development. So how does this shake out during play? Remember, your toddlers had parallel play where they were playing adjacent to each other but not really interacting. Now, our preschoolers, they are going to be engaging in cooperative play where there's a division of efforts among children. They're trying to reach a common goal. So their world is opening up a little bit and they're trying to achieve that initiative. They're trying to achieve that accomplishment. We also see magical thinking really prevalent in the preschool age group, where they think their thoughts, wishes, and desires are actually influencing the external world around them. So, how does this play out during illness and when you are going to likely be interacting with this age group? I want to tell you a story about this magical thinking in this specific age group. When I first kind of heard that magical thinking, they think their thoughts can influence the world around them, I brushed it off. Not so serious, that's not really a big deal. They're just a kid. Well, I had a child one day. It was about a 5-year-old child, and their younger sibling, about 2 or 3, was in the hospital with a terminal diagnosis, a terminal cancer diagnosis. And the parents and the child life therapist were working on explaining that in developmentally appropriate terms to the older sibling, so this 5-year-old. The 5-year-old got very quiet, very tearful, and they expressed to their mom and dad, "I'm so sorry. I'm the one who made this happen. I didn't like my little sister. I thought bad things about her, and it's my fault now that she's sick." That magical thinking, that stage of development that they're in, that child felt like their thoughts had influenced that cancer diagnosis for their younger sibling. So I really started to take this serious and realize that the way we explain the world and the way that we kind of go about explaining this diagnosis, this treatment during illness, incredibly important because their developmental stage is really going to impact the way they're thinking about it. So how can we best support that development when the child of this stage is ill? We want to encourage them achieving that initiative, giving them that sense of purpose. So set those boundaries where appropriate, but allow them to make their own choices and feel like they've accomplished something. Now, we know that during illness, we can see the child kind of go backwards, regress in their previous stages of development. That's okay. That is a normal reaction to a stressor, such as an acute illness. So let parents know not to be worried about it, support the child where they're at, and they'll progress in their development once the acute phase of this illness resolves. They might want their favorite toy with them. Last thing I'll say here, this is really important, is that kids at this age don't have a great concept of time yet. So if you tell them like, hey, I'm coming to give you your meds in 15 minutes, they're not going to get that, all right? 15 minutes is the same as 15 hours to these kids. They just don't have a logical basis to process that time yet. Now, it's better to give them concrete terms. So like when this TV show finishes, in one Paw Patrol episode, because they know Paw Patrol episodes. That gives them something concrete that lets them know when this task is about to happen. And you'll relate a lot better to your patient that way. So what milestones do we hit in this preschool age? We have 3 years, 3-word phrases. So you see their language is continuing to build. At this point, their vocab should be upwards of 200 words. They're using phrases, pronouns, and able to speak in a way that caregivers are understanding most of the time. They also understand space. So I'm hiding in the box. I'm under the table. And they can distinguish between the singular and the plural, 1 shoe versus 2 shoes. From a gross motor perspective, we talked about playing with other kids. They have that collaborative play. They can draw, dress themselves, use a fork or a spoon. So as you can see, gaining a lot of independence, hopefully accomplishing that stage of initiative versus guilt. Now, once we hit 4 years old, 4 years, 4 or more words in a sentence, all right? So full-blown sentences, they're telling you stories, they're asking how, why, identifying colors. They can also identify their own feelings and emotions. They're still egocentric, but becoming much more in tune with the vocabulary to express what's going on in their world. Now, they can group objects together, like Hamburger, ice cream, those are food. Cow, donkey, those are animals. They're playing pretend. Remember, they have that magical thinking. They're naming colors, catching balls. They can do buttons at this point. Again, able to accomplish those tasks that hopefully promote the achievement of that independence. Now, education in the preschool stage, it really falls into two buckets. What are we going to be educating the preschooler? And how are we going to be talking to the preschooler? And what education do we need to provide for the parents, right? So the preschooler is interacting with you. Remember, 4 years old, 4 or more words in a sentence. They're asking you questions. They're listening to every word that you're saying and learning rapidly. So get down on their level. Maybe play with their favorite toy with them to kind of gain some rapport. You want to explain procedures to them, all right? They are listening and picking up on everything going on in that room. It is a mistake to totally exclude them from the conversation. Get on their level, explain, and answer their questions. Do so with concrete language. Remember, they're still in Piaget's pre-operational stage. So they don't have abstract reasoning or anything yet, but they are understanding that concrete logic. So explain it to them in that way. We also want to make sure that they're actually putting their hands on and kind of handling the different medical equipment. Maybe it's a bandage, maybe it's your stethoscope. Let them touch it. Let them play with it. Let them be involved since they're in that initiative versus guilt phase. And we want them to feel like they've got some independence. Where choices are appropriate, give them that choice. One of my favorites, okay, should we listen to your heart first or your belly first? You're not giving them the choice, can I listen to your heart? Because they're going to say no, right? They're gonna be like, absolutely not. You're not touching me. Give them a choice that is appropriate, okay? And then that will give them that sense of initiative. Now, from an education for the parents' perspective, we really want to talk about preventing accidents. So we touched on a lot of this with toddlers, right? Preschoolers understand a little bit more, but they're still curious. They still might want to pull that pot of boiling water off the stove. Using those back burners, turning the handles inward, checking the water temperature, these are all still important educational points. Car seat wise, they are in a forward facing car seat by this point. Remember, 2 years old is when they're allowed to turn forward. But we want to keep them in that 5-point harness, that 5-point car seat, until they meet the specified weight limit for a booster seat. All right, so read the specific manufacturer instructions for each car seat. When they outgrow the car seat is when they can go into the booster seat. We've got a lot of kids who are outside running around, bikes, scooters. We see a lot of injuries in this patient population. Helmets, knee pads, all those protective gear. Look both ways before you cross the street. These are big safety considerations for the preschooler age group. Lastly, vaccines continue on. We've got a few at 4 years old, and don't forget about that yearly influenza vaccine. Moving right along, next up we have our school-aged kids. So in the Erikson phase of psychosocial development, this is going to be industry versus inferiority from 5 to 13 years. We have a new stage of cognitive development. Here under Piaget, our children move on to the concrete operational stage starting at age 7. So kicking us off with Erikson here, what we're trying to achieve in this developmental task is industry, that self-concept. We've already established autonomy, then we moved on to initiative. They've taken initiative. Now they need to see where their achievements stack up compared to their peers and see if they're successful. So there's a big focus on peers over family, things like academics, competitions. They're playing a lot of sports typically at this age. Are they winning? Are they successful? We want to reinforce, practice makes perfect, putting in their best effort, balancing those achievements to find that concept of self. Now, failure to sense this sense of industry, really feel like you're stacking up compared to your peers, maybe an overemphasis on perfection or focusing in on failures, struggling with boundaries, that's going to lead to the child feeling inferior. And that's when they're not able to achieve that industry and move on to the next phase of psychosocial development. Now, when it comes to Piaget, I said we're moving into a new phase here. We're moving from very concrete thinkers, pre-operational, now into that concrete operational stage. We're developing logic, we're developing organization, okay? So now they're 1 + 1 = 2. They can logic their way through it. They can look at multiple parts of an issue, so their world lens is opening up a little bit. We're less egocentric, maybe not completely. I know some 7 and 8-year-olds that are still pretty focused on themselves, but it's starting to open up, right? Cooperative play is contributing to this. They're seeing that their actions affect others, that actions can be reversed. They also develop this interesting principle called conservation, which basically is a fancy way of saying when an item changes in shape or size, it's still the same thing. So I take a cup of water from a measuring cup into a Tupperware. That water is the water. It hasn't actually changed into a new thing. So you can see how that kind of plays into our overarching idea here, that they're developing logic. So how does this play out for us as a nurse during illness? Well, as always, we want to emphasize appropriate development of those developmental stages. So we're going to look at that industry versus inferiority and try to help this child feel success. Try to give them opportunities for that industry. And that can be really hard when they're hospitalized and they don't have a lot of opportunities to achieve anything. So include them in their care. Here's a great example. Maybe they're taking off a dressing and it's kind of painful. They're pulling it off their arm. Allow them to help with that. Say, here, let's wash your hands. Let's have you get that dressing off. Include them in their care where appropriate so they can feel those successes, develop that industry. We also know that social, sports, academics, remember they're comparing themselves to their peers. Peers are going to be really important. So this is a great stage to allow friends to visit when appropriate. Now, how this factors into communicating with the child as we educate them. Well, we want to include them, and support that independence. If we can give them a choice, give them a choice. Set limits where appropriate, but encourage them to think and be involved. The more that they are, the more achievement they will feel and will be really supporting that industry. And remember, peers, really important at this age. So letting them visit when appropriate is a great idea. Now, safety, something that you want to talk to the child and the parent about because they're not very fearful at this age. And we've talked about sports, running around, they're on their bike with their friends. We've got to make sure that they're wearing helmet, knee pads, all of that protective gear as indicated. We've got a few vaccines that are recommended in this age group. Notably, the HPV vaccine is recommended after age 9 for both males and females. And of course, that yearly flu shot. Now we have our last phase of kind of childhood where we're talking pediatrics. Of course, this is our adolescence. So for Erikson, this is the identity versus role confusion stage. Starts at 13 and goes all the way up until 21. And then for Piaget, 12 is when they enter their very last phase of cognitive development, the formal operational stage. So in this Erikson phase of psychosocial development, we're really taking that self-concept, that industry that was formed in the previous stage, and solidifying this into the true individual identity that that child has. Who am I? Who and what differentiates me from my friends? We start to think about mental health, goals, trying new things, relating to others. Really, when you know you've had success in this stage of development is when they have a strong sense of who they are and what their values are, what they stand for. Now, if they're not allowed to explore this, they're unsure of themselves, they don't develop this confidence, they're unsuccessful and stuck in this role confusion stage. They might be confused about their future. who they are. Maybe they were never able to identify that stage of industry. They were stuck with that inferiority complex, and they're not really able to get into who they are and what their values are, so they don't develop that strong identity. When they're stuck in this role confusion stage, it can be really hard for them as they move on to their future and try to get out there and establish themselves in the world. So how does this translate into cognitive development? This is the final stage for Piaget. He says starting at age 12 on into adulthood is when we develop this formal operational thinking. This is not when we're just logical and concrete, but where we now develop deductive reasoning. We can think abstractly. We can think hypothetically. If this, then that, so maybe I don't want to do that. We can actually kind of use more like trial and error, problem solving. Hopefully this is the stage all of you and I myself are in. And 12 to me sounds really early for developing this formal operational, but know that it's just the start. All of us continue to develop this operational thinking as we get older, collect life experiences, and learn more and more about the world around us. So for the adolescent who is ill, how do we develop that sense of identity and not let them get stuck in that phase of role confusion? We really want to emphasize that it's important they have the ability to interact with their peers. It's important they have the ability to ask questions, that their privacy is respected, and that we engage with them on the things that they are interested in. We let them know that their identity, who they are, it's important. We're going to support that. We're going to answer their questions. We're going to treat them with respect as an individual. They do not want to be treated as a child anymore, right? They have autonomy. They have industry. Now they are developing their role in the world, who they are. So we're going to support that, respect that. We're going to emphasize that where appropriate, they can have contact with their peers so that they can develop that identity. As we educate adolescents, making sure that we respect their privacy is one of my top priorities as a nurse. They are growing up, things are changing, and they may not want their parent in the room for something. This is kind of a hard line because parents might still see them as their little baby and they want to be in the room for everything. Our priority is our client, and that adolescent's privacy needs to be respected. So navigate that carefully. That's going to really help you develop rapport with that client, and they're going to start to trust you, open up to you, and allow you to communicate and educate them in ways that you really couldn't if they were totally closed off to conversing with you. You want to talk about things they're interested in. They may be very focused on their body image, so you'll want to engage with them and make sure you watch out for any body dysmorphia and points that you may want to assess further. Now, safety is really key for this age group, and this is where I'm going to focus much more on educating the client themselves than the parents. The parents start to have a lot less control at this phase of development. That kid is getting in the car with friends, driving to school, and high-risk behavior is very common in this age group. They have this identity, they have this industry, but they don't have a lot of fear. It's often said that these teenagers think of themselves as being immortal. Nothing bad will ever happen to them. That may not be true of absolutely everyone, but it is quite common that we see high-risk behavior in this age group. So educate the adolescent. Use your seatbelt. Drive carefully. Know who you're getting in the car with, right? We want to make sure that we're not stopping them from living their life. We're going to communicate with them respectfully, but we're going to inform them of these high-risk behaviors and their consequences and ensure that we provide them with the tools to be safe. All right, time to move into our phases of adulthood. Good news, you're done with the Piaget. Sensory motor, pre-operational, concrete operational, you've got it. You're done with those cognitive stages. Formal operational is where we end, and that goes all the way into adulthood. but your Erikson stages keep going. So for young adults, Erikson sets this as 21 to 39 years old. The stage is intimacy versus isolation. So this is traditionally the phase where people are focused on close, intimate relationships, whether that be marriage, starting a family. The goal is finding that ability to accept and love someone physically and emotionally. When somebody is able to care for others and feel cared for themselves, that success allows for supportive personal relationships. Now, if they are not able to achieve that intimacy, they will have isolation, that fear of commitment, maybe being distant or isolating themselves. They're not able to engage in healthy relationships and maybe have poor social friendship or romantic relationships. Moving into middle adults, Erikson sets this between 40 and 65, and the stage is called generavity versus stagnation. So when he talks about achieving this generavity, he's talking about, all right, they've already established themselves, this industry, this identity, they've established intimacy and relationship with another, so they're confident in themselves and those close relationships. Now, moving forward into middle adults, generavity is about making contributions to that greater society. So volunteering, mentoring, how am I going to leave a legacy? What's going to be left behind when I'm not here? When you achieve this, you're proud of your accomplishments. You're proud of the life you've created. Maybe you've had kids and you're proud of them. Maybe you've had a very successful, happy relationship that you're proud of. Maybe certain accomplishments really shine and you're bestowing that on to others, so to speak. So success in that stage means that you're supporting the community, you've got the support of the community, you're looking at that bigger picture, that bigger society. Now, when a client is stuck in stagnation, they're not having success at the generavity stage, they're more self-centered. They don't have as much satisfaction in life and they're not seeking out opportunities to make contributions to the greater society. They're unable to resolve that quote unquote midlife crisis where they can't believe half of their life is behind them. And they can get stuck in this stagnation. They're kind of stagnated or stuck and uninterested in contributing to society as a whole, to this bigger society. Which leads us to our final phase of Erikson's psychosocial development, our older adults. They go through the challenge of integrity versus despair, and this starts at age 65 and onwards. So Erikson says that the integrity versus despair phase is all about achieving that composure and peace of mind that a fulfilling life leads to. So you can see how these stages build upon each other. We develop that sense of identity in who we are. Then we develop that intimacy in our relationship with close others. Then we develop that generosity with our social community, our society at large. And lastly, that integrity, that sense of fulfillment, who we are and how it has impacted our community, not having many regrets, that wisdom and peace of mind with the life you've lived. Versus a client who maybe cannot achieve integrity is stuck in despair. They may have depression or many regrets like, hey, my life, I didn't really leave a lot behind me. Maybe I never developed close, intimate relationships. I got stuck in role confusion. I didn't establish a solid identity. Or maybe I got stuck in stagnation instead of generosity, and I really didn't contribute to my society as a whole. So not leaving a lot behind. Maybe not a lot of gratitude for the life they were able to live, and they're not successfully moving on to that peace of mind, composure that it comes with integrity. So clients stuck in despair really have wishing that they could have a second chance where they're not so happy that most of their life is behind them. And this brings me to my last point about this phase, this older adulthood phase, which is that we still need to educate these clients, okay? I know I spent a lot more time on kids than I did adults here. That's just the nature of growth and development. We go through a lot more changes a lot more rapidly when we are young and developing so quickly. But that doesn't mean that development and educational needs change as we get older, okay? So for older adults, you got this in some of your other lectures too, but make sure their home is safe, all right? Many of them have high risk of falls. Do they have throw rugs and electrical cords everywhere? They could trip over them. Make sure to move that stuff. Now, what about the lighting? Is it really dim? Do they have a night light plugged in for when they need to get up and go to the bathroom? Do they have grab bars in the bathroom so that they can get up and down from the toilet okay? Look at these things and assess the home environment compared to how their mobility is, all right? Polypharmacy, huge problem in older adults. They are often on many different medications from many different providers. They can interact. They can make the client at higher risk for falls, at higher risk for drug interactions. Be careful about this. Keep an updated med list. Monitor those meds closely. We also know that our older adults are at higher risk for neglect and abuse. It's very common, unfortunately, in those older adults that are dependent on a caretaker, a family member. So we want to watch out for the cardinal signs of that. Remember, you're a mandatory reporter. This is true for children. This is true for older adults. Last but not least, immunizations, okay? Yearly flu shot still applies here. We also, starting at age 65, want to consider pneumococcal vaccination. These clients are at higher risk for respiratory infections. They're at higher risk for those infections becoming much more serious. Their immune system declines with age. So they might not be able to fight off that influenza virus quite as efficiently as they did when they were younger. Excellent work going through growth and development with me, everybody. I know this probably wasn't your favorite lecture. It's not super duper fun, but it's really commonly on your NCLEX, and I know many students who come back after failing the NCLEX really wish that they had spent a little more time learning these stages. So let's do a quick 60-second recap of what you've learned, and then you can move on with your day. First stage, we have infants. For Erikson, this is trust versus mistrust. For Piaget, this is the sensory motor stage. Don't forget that that posterior fontanelle should close around 2 months. Birth weight should double by about 5 months. Birth weight should triple by 12 months. And finally, that anterior fontanelle should close around 18 months. In toddlers, the Erikson phase from 18 months to 3 years, autonomy versus shame and doubt. And that pre-operational stage begins for toddlers at age 2. Next are preschoolers, still in the pre-operational phase. And for Erikson, the stage is initiative versus guilt. In school age, kids move into the Erikson stage of industry versus inferiority, and the Piaget stage of concrete operational. For adolescents, it's identity versus role confusion for Erikson. And in the cognitive stage of development, they move into that final stage of formal operational. Lastly, for our young adults, we have intimacy versus isolation. Our middle adults are in generavity versus stagnation, and our older adults are in integrity versus despair. I promise if you take the time to learn these stages, it'll make a huge difference on your NCLEX. So thanks for hanging with me today, Archer nurses. Remember, this isn't easy, but it is worth it. I'll see you back here next time.